talk about managing chronic conditions with remote patient monitoring. Just a little background very quickly. I teach at the Applied Physiology program, pre-med program at and the graduate nutrition program at the University of Miami. I also give lectures very often at the medical school in both exercise physiology and nutrition, which are under really heavy demand in medical school across the country, those topics, exercise physiology and nutrition. So usually when I give those lectures, I'll put this quote up on the screen as the students kind of trickle in and take their seats, because I think this quote from the father of modern medicine about 2,500 years ago serves as a reminder to us about the importance of lifestyle as part of the underlying etiology disease, which can not only be one of the most important elements of our longevity and quality of life, but medical professionals can monitor lifestyle and use it to better inform our clinical treatments, especially treatments in a way that can be proactive and preventive. So I love starting with this quote. Let's see if I can change the slide here. All right, there we go. Okay, so we are going to talk about managing chronic conditions with remote patient monitoring. And I'm going to discuss what we feel can legitimately represent a future paradigm for healthcare, one that is proactive, focuses on lifestyle, reduces trips to the hospital for patients, all while increasing revenue for physicians' practices, and provides better comprehensive care for the patients who could live longer and healthier lives. It will not, however, conjure up a digital skeleton of your patient as a hologram on your tablet, as we see in this picture, at least not yet. But technology is quickly moving. So one last slide in the way of introduction is just, I like to share this with regard to chronic disease. Our healthcare providers have always been heroes, and never more than today, at least in my lifetime. And this is not what I'm about to say to disparage really any of our great nurses or doctors or amazing healthcare technologies that exist right now. However, arguably, our current system is based largely on a 19th century model where illnesses were mainly due to infections and poor hygiene, things that can be fixed with a pill. However, what we contend with most in our modern era is in chronic disease, and it's chronic because pills do not cure these diseases, they treat them. So if we really want to get at combating chronic disease most efficiently, we have to address and assess the root cause stemming from lifestyle. This study in 2002 in the New England Journal of Medicine really motivated, I would say, my entire direction as an academic leader and an eventual inventor of our healthcare intellectual property that we use at HealthSnap. It led to our innovation, which we scaled now to foster lifestyle change in patients. And what happened in this study, essentially, they showed that a drug that reduces hepatic glucose output, metformin, if used to treat metabolic syndrome patients, pre-diabetic patients, you would prescribe nearly twice as much of the drug as you would an exercise and weight loss program to prevent one case of diabetes. So in other words, you need about 14 patients to take the drug if you wanted to prevent one case of diabetes, or about 7 patients to embrace a lifestyle change program. Now, you also have to consider what obviously can't be put in a study, but subjective data too. Not only is lifestyle more effective at preventing some chronic diseases, especially this disease, which is our leading cause also of blindness, limb amputations, and kidney failure, but if you ask patients just simply, how's life? How they feel, exercise, diet, weight loss, they lead to a better overall quality of life for the patient. A drug that improves blood markers is unlikely to have any effect on the way you feel every day. Like if you take a statin or a diuretic or an ACE inhibitor or some glucose lowering drug, it is unlikely to improve your self-image, your energy, your social life, your sleep, your happiness, your overall well-being. But lifestyle change can do that. And I feel that it's time that we infuse lifestyle monitoring and simple lifestyle changes into healthcare and stop being so cavalier about it. Now, this has been a personal passion of mine for over 20 years. So trust me, I'm used to the pushback that we get sometimes. Like, my patient's not going to eat better. My patient's not going to exercise. And I respectfully disagree, because I feel it's the way we prescribe it that can make a difference. Maybe lifestyle change isn't being titrated properly as a drug. If we add a few steps here and there to your day, or add some functional foods to your pizza or a sandwich, or take a few minutes to breathe to combat stress, simple insights on lifestyle can work. And I'll show you here how we encourage patients to execute lifestyle change. And by the way, in this study here, after the first year of the study, 26% of the patients dropped out for taking the medication. And it was exactly the same dropout rate for the lifestyle change, 26%. So that was a unique element of the study that often gets overlooked, that the patients really did address the lifestyle change recommendations in here. And imagine what they could have done had they used remote coaching and remote monitoring to add to the lifestyle intervention. So let's get into the specifics of remote monitoring and what it can do. And it can be the path. I believe it can be the path for least resistance for embedding nutrition and physical activity and other behaviors into caring for patients. Most people recognize that cardiovascular disease is the leading cause of mortality, but it is often neglected as the leading cause of disability, which it is. Getting to the doctor's appointment is incredibly arduous for these patients. It's like going to the doctor is like the task of the day for some of them. I've experienced it firsthand. As an only child, I took care of both of my parents who succumbed at an early age to chronic disease. I had to literally place both of them in wheelchairs and take turns walking them through the hospital. When patients realize that a little bit of technology can help them stay home more often while their doctors are able to remotely monitor them and check their health as they go, it gives them some security and some comfort, and definitely makes their life a lot easier. And that part we also have to focus on in addition to how it improves care. The secret sauce, however, is not just to make the patient monitoring easy for patients, but it has to be easier for the provider, make the work that providers do easier as well. It has to be easy for them. I mean, ridiculously easy. So the goal is to make it so easy that you just log in, you immediately see a triage of notifications, what patients have critical alerts, if any, that require physician attention, what alerts are clinically relevant that may require physician attention, general notifications about health and fitness improvements, changes to lifestyle scores, connectivity, et cetera. Health coaches or an MA in the office can simply open up and log into the platform and get a wealth of information about the clinic's patients. And then from that point, decisions can be made as to what next clinical steps, if any, need to be taken. I don't know anyone in my personal life more busy than my friends who are doctors and the doctors that I work with. They don't have time to invest into learning new technology or adding significant emphasis on lifestyle in which they're not trained. So we can't expect doctors to give advice on nutrition and exercise physiology if it's not part of their training, especially as a lot of doctors, they don't believe their patients will necessarily abide to those recommendations anyway. So the secret sauce needs to include literally no extra work for the doctors, and they have to get paid if they're going to embrace or even consider another technology. So fortunately, as we work towards including wellness assessments and monitoring into healthcare as part of HealthSnap to make it mainstream, there happened to be this serendipitous era of advances in wearables and home-based technology, and a greater emphasis as well, obviously, on tele or virtual healthcare methods, and a new list of CPT billing codes for simply monitoring the patient. So now you can bill insurance for remotely tracking your patients, because ultimately it will lead to saving money, and it should lead to saving lives as well. Ideally, remote monitoring could be a new age system for a new era of medicine. I believe it's the future of healthcare. It allows physicians to see how patients are doing remotely and helps patients know how they're doing and what to do about it. We strive to create a type of streamlined methodology conjured up by the biology and the etiology of chronic disease that recognizes the need for the integration of lifestyle change in healthcare without a bureaucratic or messy or wasteful, sometimes inefficient obstacles that we see, and use technology instead to better inform doctors, to save time, energy, expense, and save lives. So for each patient, you can see here that there are notifications that I mentioned that can direct the physician's attention. There's eligibility notifications as well. It takes the guesswork out of recognizing when insurance can be billed for remote monitoring codes, and a complete picture of the patient with remote monitoring so that we can do a number of things. One, we can reduce hospital admissions and we can reduce readmissions by monitoring patients from home. We can advance and enhance value-based care. We can improve tele and virtual healthcare, which is better with monitoring anyway. We can add to the existing employee wellness programs that are out there and coaching systems by remotely monitoring the employees and other coaching clients. And additionally, on top of that, we have these RPM billing codes for physicians. So the overall concept is quite simple. Like here's 3 examples. So you have your diabetic who's using a continuous glucose monitoring device. If he gets some postprandial excursions in his glucose that are of concern, or he is hypoglycemic, an alert can be placed on the platform and the physician can adjust the medication. Or if a hypertensive patient has a higher than normal and outer range blood pressure, a telehealth visit can be scheduled. If a patient who is struggling with being obese and having comorbidities associated with obesity is containing weight, we can schedule a nutrition visit through the platform. I mean, there's a number of things we can do remotely to make our care for these patients better. And if you can think about it, I mean, is there any better way of keeping your chronic disease patient out of the hospital than to remotely monitor them and contact them when things need to be addressed? We give them so another thing we do is we give them a state-of-the-art patient app that has a wellness assessment built in with evidence-based lifestyle recommendations. You know, that's the goal. So aside from making it so easy for physicians that they don't have to do really any extra work, we want to make it insanely easy for the patient. I remember, what I always think about as we build our technology is the first time I ever got an iPad. I got one of the first iPads when they came out, and it had more technology in it than the space shuttle, but it came with no instructions. You just open it up, push a button, and it works. And our collaboration with different device companies with a special hub connected to the wall can get us close to that. You take your blood pressure, a hub connects it, and the data now flows seamlessly and integrates with our platform. Same with a scale or wearable fitness devices. The lifestyle and physiological data that we monitor in patients can now be easily placed on the platform and integrated as part of the electronic healthcare record, and all saved on a secure HIPAA-compliant platform, of course. The alerts for physician groups or for hospital systems, they can be, whether we have default ones that are in place, but of course they can be adjusted for patients as a provider or system feels appropriate. The data, the de-identifiable data, can be used for a number of things with countless benefits that can be extracted from this data to contribute to improved management of their hospitals and their patients. So for example, here we filtered by exercise level and A1C, and we can track patients as we go. So we can look not just at individual patients, but at groups of patients for improved care. And you can have a great platform for providers as we do, but you need to focus on the patient. I tell our entire team at HealthSnap that the moment we are not thinking about patients, we lose sight of the vision that we fail. The entire new wave of healthcare must be focused on a patient. Without that, you have nothing. So we put a tireless effort into creating a beautiful, all-embracing patient app that is basically a book on you as the patient. And it gives you more information about your lifestyle and physiological health than you'd find anywhere, with evidence-based and actionable insights on how to improve in all these areas, from metabolic health and cardiovascular fitness, nutritional indices, musculoskeletal health, stress management, sleep, hydration, you name it. All those things we're able to monitor. I'm going to have a little quick video of the app here. It looks like I'm going to have to just refresh. Sorry about that. Let me see if that works, because I want to show the app. And yeah, let's go ahead and present it, because I want to show just a few of the features that we have that really provides patients with a lot of information on their health and what to do about it. Like I said, it gives them actionable insights. So here's the, let's take a look at the nutrition only. So this is some of the indices that we score on nutrition, like gut support and sugar fiber index and antioxidant index. Let's go ahead and click on the antioxidant index. And in here we can see that this person scored high. What that means to score high in terms of antioxidants in the diet, what oxidative stress is, and then some evidence-based recommendations as to what you can do to improve your score even further. We can look at other markers as well, just on nutrition. So here's an index on healthy fats and the value of those healthy fats in your diet, et cetera. We also can look at favorite insights. We can filter it by the ones that we think are most important. So here's cardiometabolic related insights. We can take a look at the cardiovascular score, body fat, and metabolic score. We can see macronutrient recommendations and caloric recommendations. We can go down and look at VO2 max or Framingham score and all kinds of things related to heart health, blood pressure, what it should be and what it is, and how to improve it. Again, focusing on the patient, focusing on patient engagement in addition to having a platform for the doctors. So we have this platform for physicians, but then over here, for example, we have a thing on stress on the patient, what their stress level is, how it's measured, what it means, and what they can do about it. So we want to also keep in mind that we have to make this user-friendly for the patient. A nice patient app that we work so diligently on to include alongside our remote monitoring platform, because both should go hand in hand. So overall, what collecting is what I call invisible data, and using wearables and home devices to track patients' lifestyle and physiological data in a way that really requires no effort on the part of the physician and can alert her or him to any potential markers that require attention in a HIPAA-compliant, high-trust certified platform ready to integrate with EHR and allow for more telehealth and virtual healthcare through the platform. Be billable, not just simply provide remote monitoring, but also to help provide better proactive care. This is a new system of healthcare, we believe, and we can tie in all kinds of professionals into it. So what I'm going to do is show you a few examples of how it works. Each provider gets a numerous detailed information on different patients that are connected, how many patients have been invited, which types of billing codes are aligned, what kind of alerts have come in. If it's a large enterprise with multiple physicians, they can look by physician at what codes are being billed for and what elements are being monitored. And they can look month to month at these things. And then we can treat each situation better, I believe, through remote monitoring. And not just taking a look at the wearables and taking physiological lifestyle data, but also just talking and communicating with patients about how they feel. So let's take atrial fibrillation, for example. If we're measuring heart rate variability and we see consistent levels below 50 or high, significant changes from the norm, changes from the control level, if we see changes in arterial oxygen saturation, or subtle changes in physical activity and other markers, and if we are communicating with the patient and we see how they feel, like the difficulty breathing and changes in their energy level, all that is really useful information remotely that can help see events potentially before they arise. I always give an example. If you're monitoring a patient in cardiac rehab and you see something on the EKG that may be an artifact or it may be real of concern, your first move is to look at the patient and you say, how do you feel? If the patient says he or she feels fine, looks good, you just adjust the electrodes. If everything's fine at that point, you carry on. We can't forget how important it is to simply ask a patient how she or he is feeling. If we take a look at cancer, changes in lean mass index or BMI, changes in appetite, changes in physical activity, how they're feeling in terms of their nausea and their energy levels. All those things are important to consider and also to put into algorithms to help predict events in the future, to see if a patient is recovering and how they're recovering or how they're handling treatment is key. Being able with chronic kidney disease to take a patient with kidney disease and prevent them from going into complete kidney failure by monitoring things like blood pressure, looking for variations in weight, like weight gain of 2 to 3 pounds in a day, or 5 pounds greater than baseline associated with edema, or blood pressure that's significantly out of range, or other symptoms and feels like cramps and swelling and changes in appetite. Those are all things that obviously help inform clinical decision-making that can be done remotely through the platform. Diabetes, as most of you probably know, half of Americans are either pre-diabetic or diabetic. And if we see fasting blood glucose under 100 or we see postprandial glucose excursions, or we see ketones over 1.5 millimoles per liter, or if we see observations or the patient reports things related to neuropathy, poor skin health, changes in their energy levels. Again, all these are useful to monitor over time remotely and helps inform clinical decision-making. With heart failure, looking at arterial oxygen saturation, changes in blood pressure, again, looking at changes in weight and edema, and figuring out about energy levels of the patient and difficulty breathing, all things that we want to monitor. And very similar to heart failure, COPD, measuring VO2 max, which is a very important predictor of longevity and mortality risk in these patients, and looking at heart rate if they're tachycardic with a resting heart rate over 110, or if their physical activity level drops, other arterial oxygen saturation, obviously, if it's under 92%, changes in if we're using a spirometer and peak flow, and of course, monitoring feels like wheezing and night coughing and dyspnea. These are all things that through an app, when we remotely monitor the patient, just imagine how much it informs you and helps you be aware of things that are that lie ahead that could be potentially a clue as to an event that's going to occur. So my final slide is just kind of a summary of the importance of prevention. And one of my favorite quotes when we think about prevention and guiding patients, especially using prevention, guiding them away from obstacles that are potentially dangerous. And it's from Dr. Dennis Burkitt, the oncologist. If people are constantly falling off a cliff, you can place ambulances under the cliff, or you can build a fence on the top of the cliff. We are placing all too many ambulances under the cliff. In this case, remote monitoring can help be a way of erecting a fence at the top. It can be something that helps act as a guardrail, keeping patients in a healthier path towards improved health and improved quality of life. So with that, I'll take questions, and I appreciate you listening to my spiel today.
Thank you so much, Wes, and thank you everyone that submitted questions. We did have a few come in, and we will try to get to all of them. Anyone whose questions we don't get to, we promise to follow up with you and answer them directly. So the first one we got is, how is HealthSnap different from other RPM companies?
Well, one of the things that we really instill in our platform that, again, is key is the emphasis on the patient's lifestyle, the integration of wellness, things from looking at behaviors, assessing behaviors like basically a virtual consultation, an AI-based consultation, complete wellness consultation, along with like a virtual dietitian and a virtual exercise physiologist or trainer, because not only do they have all these things assessed, like here's your fitness age, and it compares to your chronological age like this, and here are the things you can do to improve it. And here's your nutrition score, here are the things about your nutrition that need improvement, and here are the things that you can do to fix it. So that important element of infusing wellness into the entire remote monitoring, I think, is something that really stands out. So that way, we're not just giving a tool to the doctors, here, monitor your patients. We're saying, here, patients, here's an app for you that's going to tell you more about your health and your lifestyle than anything out there, we believe, anything, with great recommendations that are all evidence-based. And by the way, your doctor is able to connect through this and monitor you and notify you if there's anything out of concern. So, this is what really makes us stand out. We also have those eligibility codes, and the way in which our data flow is collected is a patent pending process. So there's a lot of things that stand out that make us different.
Great. So another question we received, and I wanted to mention to everybody that's on the call, I am about to pin our website in the chat. So please feel free to visit our website. It's healthsnap.io. And then on to the next question. So in addition to what's monitored for chronic disease, what other suggestions do we offer for using lifestyle to manage chronic conditions in conjunction with RPM?
Okay, yeah, that's a good question. So when we think of remote monitoring, a lot of times, I don't know why this happens, but a lot of times in conversations at conferences or wherever, it's immediately like billing codes and how much revenue, and that's, remote monitoring should be thought of as a new wave of healthcare, and it can do all kinds of things. So I know physicians that are frustrated with telehealth. They're not really that happy with the standard way in which they might be conducting telehealth, maybe personally even using FaceTime, they're doing it on their own, because they don't see anything that tells them data on the patient. So remote monitoring greatly improves the efficacy at which we can carry a virtual health visit with a patient or a telehealth visit with a patient, because now we have the data there to back it up, and arguably better data than if the patient comes into the office. Because if I know what your blood pressure has been over the last several weeks, as opposed to what it was like today, where you may have had terrible traffic getting in and waited and had giant coffee while you were in the waiting room, and I'm going to have a more informed decision, and the telehealth visit is going to be more effective. The other thing is that, as I said earlier in the presentation, it should greatly enhance all mechanisms of value-based care, because you can't really think of a better way of keeping a patient at the hospital than to remotely monitor them and contact them when you see things that are not in the optimal ranges. So you see these events before they arise, really the core of prevention. And then along those lines, reducing hospital admissions, reducing readmission penalties. A patient that leaves cardiac rehab, very few of them actually, leaves a cardiac procedure, very few of them actually show up for cardiac rehab. But at least if you can remotely monitor them and you can give them recommendations, you should be able to cut down on readmissions significantly. So you have all those benefits. And then, oh, by the way, in addition, you got CPT codes that you can bill for, but that shouldn't be the whole premise. Again, in my opinion, as soon as any healthcare company starts thinking about making money and just focusing on revenue and RPM billing codes and all that, they're going to fail. It has to be about improving care for the patients. I'm an academic, so I'm not a business person. So I obviously got into this because I'm passionate about it, about seeing changes in healthcare that can really help with prevention.
Great, thanks, Wes. And then the next one we received is, are you currently doing any research around clinical outcomes?
Yeah, so that's a perfectly timed question because it's related to what I was just mentioning. So, we're collecting data right now on the changes that we see using remote monitoring. So, for example, with remote monitoring and patient app, we're seeing that we can change the status of a patient from, let's say, someone's stage 2 hypertensive and now they're stage 1, or we can see that their medication compliance is better, or we can see that the remote monitoring may have informed some clinical decisions and changed the way in which certain medications were being prescribed. In some cases, patients not feeling well anymore, we can't figure out why, and then it determines that, well, they improved their lifestyle, so they don't need these medications. So some of these medications, we can stop prescribing them. And we're looking at admission rates versus controls and readmission rates. So there's a lot of things that can be collected. And as a professor, I always say the best study to do is the one that has never been done before, but you already know the answer. And in this case, we know that remote monitoring is going to improve care. We just have to now complete the studies. They're the best studies to do where you already know the answer, but the research hasn't been produced.
Well, thank you so much, Wes, and to everyone that asked questions. We didn't get to everybody. We're coming up on the 11:30 mark. So if we didn't get to your question, we will have one of our specialists follow up with you directly to speak and answer your questions. And we just want to thank everyone for joining us today. We hope that you were able to take away some new and useful information. And please feel free to connect with our team on LinkedIn. In the meantime, we will be sending you the recording as a follow-up. So stay tuned with us. We have another webinar coming up next week on Thursday, July 30th. So we'd love to have you join us then as well. And if you're interested in learning more about HealthSnap's remote patient monitoring solution, please visit our website. I linked it in the chat. It's www.healthsnap.io, and you can request a demo directly there. So with that, we'll be following up shortly with today's recording, and please feel free to send us any additional questions that might come up. We thank you so much for joining us today, and we look forward to talking more soon. Have a great day.